Dr. Stein, tell us a little bit about dentures, especially actually tell us about dentures as they, people have a denture and apparently, all of a sudden they start not fitting, and people have sometimes a misconception on why they stop fitting, and they blame the denture when it really happens to be that their bones and their gums simply shrink, and this thing cannot possibly fit. Go and what do you find in most cases as people come in with those problems?
Yeah, a denture, the denture itself doesn't change. It's made at the time, it's made to fit a point in time where it was, that's the shape of the jaw. On its own, it doesn't adapt. There becomes, the bone continuously changes, and especially without teeth, the layer of bone, that's the alveolar bone, which was there at the time the teeth were there, continuously shrinks. You get the most shrinkage immediately after the extraction, but there's still continuous shrinkage, especially when you apply pressure. The pressure from the denture applies pressure on the bone, so that causes a gap between the denture and the bone, so that over time, usually after about three years or 5 years, most dentures will need to be relined, assuming the denture is still in good condition. Most cases, 3 to 5 years, a denture should still be serviceable, but it does need to be relined. Again, some people more than others. It depends on the rate of bone loss. But people do need to realize that the best way I heard it described is that dentures are not a replacement for teeth. It's a replacement for no teeth. It's a replacement for, rather than having no teeth, people have the misconception that a denture is, they don't have to worry about teeth anymore. In one sense, that's true, but it's not the same. Having a denture is not the same as having your own teeth. And it does have its own care and both care of the denture and things that can go wrong. Where a denture can break, a denture, things like that can be repaired, but definitely they need to be relined.
Right. Well, a denture is not only not the same than having your own teeth, it seems also not to be the same, but let's say having implant, which is still not having your own teeth, but it's damn close to having your own teeth. And very importantly, when you have a implant, that metal stick which goes into the tooth kind of like signals the body that you have a tooth in it. It doesn't know that this is a metal stick and a tooth root, and by doing so, the jaw bones, basically the bones around, they don't shrink. And if they don't shrink, they don't make you look ugly, because that's where the people with dentures, right, their bones shrink, they keep blaming the denture. The denture is just a steady piece of plastic which stays for that forever, but the bones shrink, same way than if you lose weight or gain weight, our trousers stay the same, it's just we change, and then it shrinks, and all of a sudden you look ugly, and you look like a dried out tomato, and like one of those hexes flying around, which is probably based on the fact that they all had dentures. So basically, having your own teeth, or at least having implant versus denture, takes off years, decades even, of your look.
Yes, losing teeth, if a person doesn't have a denture, they have become a very sunken look, the whole face kind of sinks in, the lips, they move forward, and it just looks it really doesn't look good, and that's why a big part of the function of a denture is not only to add teeth, but to add a lot of extra plastic or acrylic to fill, it's filler material to fill the space that's missing, to give as close of a natural look to a person as at the time that they had the teeth, but it's not the same. And you're right about the implants. make the body think that the tooth is still there, and it helps preserve bone. And in fact, they can actually do bone grafts, actually build the bones to a point where it was even stronger than it was in many cases. So with implants really have come a long way. So it's a much more natural way of stronger and a natural feeling of having teeth, and in terms of the body, views it as having your own teeth. So it helps eat better and more comfortably. Even if it's a denture that's retained on implants, that's another option too. Not people, there's somewhere in between. Not that everybody can do all teeth. But even an implant retained denture is a good option, because it helps the denture be more stable, and it helps to minimize bone loss, so that the denture will stay better, and so that's a good option as well.
Right, which basically means have one or two implants in it on each side, and then the denture sits on that rather than sitting on your gums and pressuring on it, and a bone shrinking even more so. All right, yes. Well, wonderful. Okay. So most of the time your gums have been shrunken, and not always, but in most of the time you just simply need a new denture. And ideally, you replace it at that point with an implant, or with implant-supported denture at least, so that doesn't happen anymore. Correct?
Correct, yes.
Well, all right. Bye-bye, Dr. Stein.
Okay, bye now.